All right, strap in everyone, because today we are going deep into the world of AI, and specifically how it's transforming robotic surgery.
Yeah, it's really incredible.
We've got this super interesting excerpt, and it really lays out how AI is totally changing the game.
It's not just about assisting surgeons anymore.
Right. It's gone way beyond that.
We're talking about the potential for semi-autonomous robots, even autonomous capabilities.
Yeah, it's mind-blowing stuff, and we're going to unpack it all today, right?
Absolutely, should be fun.
So, robotic surgery has been around for a while, but this excerpt really highlights how AI is taking it to like a whole other level. It's like this massive upgrade in terms of precision and what these systems can actually do.
Yeah, you hit the nail on the head. It's like taking existing tech and giving it a super boost.
So no more clunky robots, right?
Right. We're way past that.
Because this excerpt talks about how AI is allowing these robotic systems to actually analyze medical images.
Like MRIs and CT scans.
Yeah, in real time, as if they can see what the surgeon is seeing.
Exactly. So the AI is processing all of those images on the fly, guiding the robotic arms with just incredible accuracy. Imagine something super delicate like tumor resection, where even the slightest tremor could be a problem. But AI is eliminating that human variability.
Wow. Okay, so that level of precision has to be a game changer, especially for complex procedures where like every millimeter matters.
Absolutely. I mean, it's making a huge difference already.
And it goes even further, right? Because this excerpt mentions how AI is actually using machine learning.
Yeah, and to actually analyze data from thousands of previous surgeries.
To do what? What's the point of that?
Well, it means the AI can predict potential complications before they even happen.
Well, hold on. So it's like AI is learning from all of those past surgeries and saying, hey, based on what we've seen before, you might run into this issue here.
Exactly, you got it. It's all about minimizing risk and coming up with the best possible surgical approach for each individual patient.
It's like having a superpowered assistant in the operating room, which, by the way, this excerpt also mentioned voice control. Oh, yeah.
Is that as cool as it sounds?
Oh, it's pretty amazing. I mean, surgeons can literally use their voice to give commands to the robotic system, hands-free.
Wow. Okay, so they don't even have to use their hands.
Exactly. It frees them up to totally focus on what they're doing.
That's incredible. Okay, that is straight out of like a sci-fi movie.
Yeah.
But what about the sense of touch? Because surgeons rely so much on their hands, right, to feel what they're doing. How does AI deal with that in robotic surgery?
Yeah, that's a great question. And it was a big limitation with some of those earlier robotic systems, the lack of haptic feedback, that sense of touch.
Right.
But get this, AI is now being used to develop something called, well, haptic feedback, which is, well, think of it like this. Tiny sensors are in the robotic arms.
Okay.
They're picking up these subtle pressure changes,
Mm-hmm.
and they're translating those into vibrations.
Okay.
And the surgeon can feel them through the controls.
So the AI is essentially recreating that sense of touch for the surgeon, even though they're operating remotely through the robot. Pretty much, yeah. It's really remarkable, especially for those super delicate procedures where that sense of touch is just absolutely essential.
Wow. And it's not just theoretical, it's actually being used, right?
Exactly. There are systems out there doing this right now.
This is where I need you to break it down for us. Like,
Yeah.
what are some of these AI-powered robotic surgery systems that are making, like, the biggest waves right now?
Sure. Well, one that's been around for a while, but it's always evolving and improving, is the Da Vinci surgical system.
Oh, yeah, I've heard of that one.
It's pretty popular, and now they're incorporating AI to make things like laparoscopic surgeries even more precise.
Mm-hmm.
Then you've got systems like the Maser X. This one is specifically for spine surgery.
Okay.
Think about the accuracy needed for something like spinal fusion or implant placement.
Yeah.
AI is helping surgeons achieve that.
So AI is being tailored to specific types of surgeries, which makes sense. What are some other examples?
Well, there's this system called the Monarch platform, which is really incredible. It's an AI-assisted robotic bronchoscopy system,
Okay.
and it's actually being used to help with early lung cancer diagnosis.
Early diagnosis is key, especially with lung cancer. How does it work?
So basically, imagine this tiny camera on the end of a robotic arm,
Okay.
and it can move through the airways, reaching all of these hard-to-access parts of the lungs.
Oh, wow.
And the AI is helping to navigate and to identify those potential problem areas much earlier than was possible before.
Wow, that could be life-saving for so many people. Any other systems on your radar?
There's also the Versius robot.
Oh.
It's a next-generation robotic assistant, and it's all about minimally invasive surgery. It's designed to give surgeons even more control and dexterity while making the whole procedure way less invasive for the patient.
It's amazing how much this technology has advanced.
It is.
But, all of this is super impressive from a tech standpoint, but what does it actually mean for the patients?
Right.
What are the real-world benefits of actually having AI in the operating room?
Well, at the end of the day, it all boils down to better outcomes for the patient.
Okay, how so?
Well, for one, higher accuracy means smaller incisions,
Okay,
less trauma to the body,
makes sense.
and of course, faster healing. Plus, there's a lower risk of infection and all those post-operative complications that can sometimes happen.
Right, so it's not just about the surgery itself.
No,
It's about the entire recovery process being smoother and hopefully a lot less painful for the patient.
exactly. And AI can actually help to reduce the length of the surgery itself because it can take over some of those more repetitive tasks,
Yeah.
and provide that real-time guidance. It can help the surgeon work way more efficiently.
Oh, I see.
And that has the added benefit of reducing surgeon fatigue.
So it's a win-win.
Yeah, for both the patient and the surgeon. And there's also the potential for even more personalized treatment plans.
Oh, okay, how so?
Well, AI can analyze a patient's individual data,
Hmm.
things like their medical history, their genetics, even lifestyle
Oh.
factors, and use that to create a truly tailored surgical approach.
Wow, that's amazing.
Yeah, it's taking personalized medicine to like a whole new level.
That's incredible. And I imagine all of this leads to lower healthcare costs in the long run.
It should.
Fewer complications,
Exactly.
shorter hospital stays.
Yeah, while the initial investment in these AI systems, it is pretty significant. The potential for long-term cost savings is huge. And when you add in those improved patient outcomes, the reduced risk, it's a pretty compelling argument for, wider adoption of this technology.
It really does sound like AI and robotic surgery has the potential to completely transform healthcare for the better. But I imagine there are also challenges
Oh, absolutely.
and ethical considerations that come with a technology this powerful, right?
There are a lot of nuances to consider.
Is that something that this excerpt delves into?
Oh, it does, and I think that's a perfect place to pick up after a quick break.
Okay, sounds good. We'll be right back. We're back and ready to, really dig deeper into this world of AI and robotic surgery. Before the break, we were talking about all those amazing potential benefits like faster healing times for patients, more personalized treatment. But, with any new technology, there are always some challenges that come along with it.
That's true, and one of the things that often comes up is just how complex these AI systems really are.
Okay, in what way?
Well, it's not just about having the robot,
Mm.
right? It's about having the right team, the right people who really understand it,
Okay, to operate it.
to operate it, to maintain it.
Yeah.
That takes some serious training, real expertise.
So you need a whole team of experts behind the scenes, like making sure that everything is running smoothly.
Absolutely. And then there's the whole data issue.
Okay, what do you mean?
Well, AI needs a ton of data to learn, to improve. And in healthcare, we're talking about sensitive patient information. So gathering these huge data sets, managing all of that, while still making sure that everything is private and secure, that's a massive challenge.
Yeah, data privacy is a huge concern, especially when you're talking about people's medical records.
For sure. You need really robust systems in place, to protect all of that information and make sure it's not being misused.
Of course, of course. What about reliability, though? Because no system is perfect, right?
Right.
And AI systems are no exception. Isn't there always a risk of some kind of unforeseen error or a glitch?
Yeah, and that can be a bit unnerving when we're talking about something as serious as surgery.
Yeah, I was just thinking that because, even a small error in surgery, that could have really serious consequences.
Absolutely. That's why testing is so important. Before any of these systems are actually used in a real surgical setting, they go through tons of testing simulations.
So it's really rigorous.
Oh yeah, very rigorous. And even after the system is actually deployed, they're constantly being monitored,
Okay.
updated, to address any issues.
So it's like an ongoing process of improvement.
Exactly, exactly. And, it's not just about the technology itself, it's also about that human element. How are the surgeons adapting to working with these AI systems?
Yeah, that's a good point because surgeons are used to being in control, right?
Yeah, and this is a different way of working.
So how has that transition been?
I think it's definitely a learning curve.
Hmm.
Surgeons are used to, being the ones making all the decisions, but with AI, it becomes more of a collaboration.
Interesting.
The AI is providing these insights, this assistance in real time, but ultimately it's still the surgeon who's making the final call.
It's like having I don't know, like a highly skilled partner in the operating room with them. What about the patients, though?
Yeah.
How are they feeling about this whole, AI-powered surgery thing?
You know, like with anything new, I think there's always a little bit of hesitation at first.
Yeah, of course.
I mean, some patients are probably a little uneasy about the idea of a robot being involved in their surgery.
I can understand that. It's a pretty big leap of faith to put that much trust in a machine.
It is, it is. But, as people become more familiar with the technology, as they see those positive results, I think a lot of that hesitation will start to fade away.
Hopefully.
It's all about education
Right.
and transparency. Patients need to understand how these systems work, what the benefits are.
And the risks.
Exactly.
Yeah.
And knowing that ultimately their surgeon is still in control, right? It's not like these robots are taking over the operating room or anything.
Right.
It's about that combination.
Of, human expertise.
Exactly. Human expertise, the best of that combined with, the power of AI to achieve the best possible results.
That makes sense. But I think it's also important to consider the bigger picture here, right? How is AI going to impact the entire medical profession? Not just the surgeons, but everyone.
That's such a crucial question. I mean, this is about more than just the operating room. This is potentially impacting the entire healthcare system.
Yeah, for sure. And I imagine one of those impacts is going to be increased efficiency.
Oh, definitely. I mean, think about all of the tasks that AI could potentially automate.
Yeah.
That frees up the surgeons, the nurses, everyone to focus on those more complex cases. It could potentially even reduce those crazy wait times that patients are dealing with.
Right. Yeah, that would be huge, especially in those areas where there are super long wait lists for surgeries.
Mm.
But what about the potential for job displacement?
That's a valid concern. I mean, as AI gets more sophisticated, there is a chance that it could start automating some of the tasks that are currently done by, human medical professionals.
Yeah.
So it's something we really need to think about. How do we adapt to these changes? How do we make sure that everyone benefits?
That's a good point. It really does feel like we're witnessing the birth of a whole new era of healthcare. It's exciting and a little bit scary all at the same time, but we're still in the early stages, right?
Oh, absolutely.
Where do we go from here? What are the researchers working on?
Well, one of the big areas is image analysis. Researchers are constantly working to improve AI's ability to understand and interpret those really complex medical images.
What kinds of images?
Well, think about 3D scans, those real-time video feeds coming from those tiny endoscopic cameras.
Oh, right, right. So it's about taking what AI can already do, with image analysis, and pushing it even further.
Yeah, taking it to the next level.
Mm.
The goal is to develop AI that can extract even more information from these images, giving surgeons that much more complete picture of what's happening inside the body.
Okay, that makes sense. What else are they focusing on?
Another big area is, personalized surgical plans. AI is being used to analyze all of that patient data, the medical history, genetics, lifestyle factors, to really create that individualized treatment plan that's tailored for each patient's unique needs.
It's like designing a surgery that's just for you.
Exactly.
Based on your DNA, basically.
That's pretty much it. And then there's all this research going on with autonomous robots.
Autonomous robots.
Yeah, systems that can perform certain tasks.
Okay.
Maybe even, whole procedures, but with minimal human supervision.
Whoa, hold on. That sounds like something out of a sci-fi movie. Autonomous robots performing surgery. Is that really a possibility?
Oh, it is. It's definitely a possibility, especially for those more routine, lower-risk procedures. We could see those robots taking on, a bigger role in the operating room.
That's kind of amazing and a little bit scary. But I guess, with any technology, you have to move carefully, right? Especially when it's this powerful.
Oh, absolutely. We have to be really thoughtful about how we develop and use these technologies. There are a lot of ethical questions here.
Yeah, like what?
Well, questions about responsibility,
Okay.
liability. What's the role of human oversight in all of this?
Right, right. There's a lot to consider.
A lot to think about.
It's definitely a lot to wrap your head around, but it's also, incredibly exciting to think about what the future holds for surgery. It does feel like we're on the verge of something really big.
I think so, too. And, it's important to have these conversations now
Yeah.
while these technologies are being developed to be proactive, to make sure that we're using AI in a way that benefits everyone.
Well said. Well said. This has been a really eye-opening conversation, and we've covered so much, from the basics of AI to the benefits, the challenges, the ethical questions, even a glimpse into the future. But there's one big piece we haven't talked about yet, and that's the economics of it all. I mean, developing and implementing all of these cutting-edge AI systems, it can't be cheap.
Right, that's a great point, and I think it's something that often gets overshadowed by, all of the excitement about the tech itself. But the truth is, AI in robotic surgery, it comes with a hefty price tag.
Okay, in what way?
Well, the initial investment is substantial, and then are all of those ongoing costs.
Like what?
Maintenance,
Okay.
training,
Mm.
software updates, you name it.
So it's a major commitment for hospitals and healthcare systems to even think about adopting this technology.
It is.
But is there potential for long-term cost savings?
Oh, absolutely. I mean, one area is hospital stays. If AI can help surgeons perform these procedures more efficiently, with fewer complications, patients are going to recover faster,
Mm.
they can go home sooner, and that translates into lower overall costs for everybody.
Okay, that makes sense. And we talked about how AI can potentially help to prevent surgical errors, which I imagine also plays a big role in saving money, right?
Oh, huge, huge. Because those surgical errors can be devastating, not only for the patients, but incredibly costly for the healthcare system. And AI has that potential to act as a safeguard, providing real-time guidance, alerts to the surgeon, double-checking their work, basically, and ultimately reducing the likelihood that those errors will happen in the first place.
So it's not just about saving money, it's about actually improving patient safety and preventing those really awful complications. What other economic factors should we be thinking about here?
Well, as AI becomes more commonplace in healthcare, there's going to be a greater need for training, for education. Surgeons, nurses, technicians, everyone involved is going to need to be equipped to work with this technology. So we need to invest in education and workforce development.
It's like a domino effect.
It is.
The technology is just the first step.
Yeah, you need that infrastructure. You need a skilled workforce to support it. So as we wrap up this deep dive, what's like the main takeaway that you want our listeners to walk away with today?
Well, I think the biggest thing to remember is that AI in surgery, it's still very new. It's evolving all the time.
Hmm.
And there's just massive potential for it to revolutionize this entire field, to make surgery safer, more precise, accessible to more people.
Well, it's not a magic bullet?
Exactly. There are hurdles to overcome, right? Ethical issues to think about, economic realities to figure out. But with careful planning, thoughtful implementation, ongoing research, I think AI can reshape the future of surgery and improve countless lives along the way.
It's exciting and a little bit daunting, to be honest.
It is, and it really highlights how important it is to stay informed, to be part of this conversation, because the future of surgery is being shaped right now. It's up to all of us to make sure that these advancements are used ethically, responsibly, and for the benefit of all. That's a great point to end on. This has been an incredibly insightful deep dive. We've covered so much ground today, and I hope you found it as fascinating as I have. It's definitely something we're going to be talking about a lot more in the future.
Absolutely.
Thank you so much for joining us and for sharing your expertise with us.
It's been my pleasure.
And to our listeners, keep digging deeper, stay curious, and never stop questioning the world around you. Until next time, keep exploring.
Okay, so we're back, and we've been talking about all of these incredible advancements in AI and robotic surgery. But let's be real for a second. Developing this kind of cutting-edge technology, I mean, it can't be cheap, right?
You're absolutely right. The economics of this are a huge factor. And honestly, it's something that often gets overlooked. People get so caught up in the excitement of the tech itself. But the reality is, AI in robotic surgery comes with a pretty hefty price tag.
I can imagine.
I mean, the initial investment alone is substantial, and then you have all of the ongoing costs on top of that.
So, like, what kind of costs are we talking about? Oh, maintenance, training for the staff who are going to be using these systems, software updates, it all adds up.
So it's a pretty big commitment for hospitals and healthcare systems to make.
Oh, absolutely.
But are there any potential cost savings?
Definitely. Yeah, in the long run, I think we could see some significant savings. And one area is hospital stays. If AI is helping surgeons to perform these procedures more efficiently, fewer complications, it stands to reason that patients are going to recover faster.
Makes sense.
They can go home sooner,
Hmm.
and that translates into lower costs overall.
Yeah, it's all connected.
It is. And we were talking earlier about how AI can help to prevent surgical errors. Those can be incredibly costly for the healthcare system. So that's another area where we could see some real savings.
So it's not just about saving money.
Right.
It's about improving patient safety, which is huge.
Absolutely. It's about preventing those complications that can be really, really life-altering for some patients.
So what other economic factors should we be thinking about here?
Well, as AI becomes more and more integrated into healthcare, I think there's going to be this growing need for training and education. Surgeons, nurses, technicians, everybody who's involved in this is going to need to know how to use this technology effectively.
Hmm.
So, investment in education and workforce development is going to be critical.
It's, like you said earlier, it's this ripple effect.
It is.
The technology itself is just the beginning. You need the infrastructure, you need people who know how to use it. So, I mean, we've covered a lot of ground in this deep dive today.
Yeah.
We've talked about the potential benefits of AI, the challenges, the ethical considerations, and now even the economic implications. So, as we wrap things up here, what's like the one key takeaway that you want our listeners to leave with today?
That's a great question. I think the most important thing to remember is that this is still a very young field.
AI and robotic surgery.
Yeah, it's constantly evolving, and there's so much potential here. The potential to revolutionize how surgery is done, to make it safer, more precise, and accessible to more people around the world. But it's not a quick fix. It's not a magic bullet.
Right.
There are challenges that we have to overcome. There are ethical considerations that we have to address, and of course, the economic side of things that we have to figure out.
Hmm.
But if we do it carefully, if we plan well, if we implement this technology thoughtfully, and we continue to do the research, then I think AI can reshape the future of surgery
Mm.
and improve a lot of lives along the way.
It's exciting, and it's a little overwhelming, honestly, to think about all of the possibilities.
It is. And I think that just highlights how important it is for all of us to stay informed
Yeah.
and to be a part of this conversation.
Yeah, I agree.
The future of surgery is being shaped right now, and it's up to all of us to make sure that these technologies are used responsibly and for the benefit of everyone.
Well said. And on that note, we've come to the end of our deep dive into this incredible world of AI and robotic surgery. We've learned a lot today. I hope our listeners have too. This is a topic that's going to keep evolving and changing in the years to come, and I'm sure we'll be revisiting it again soon.
I'm sure we will.
It's been a pleasure having you with us. Thanks so much for sharing your expertise with us.
It's been my pleasure. Thanks for having me.
And to our listeners, as always, keep exploring. We'll see you next time.